Well, I trained at the University of Minnesota, and in the last month of my residency, it was one patient that woke me up to how medicine should really be. And it was one night I'd been on call all night, sat in the foot of his bed at 6:30 because I was tired. And as I watched, every specialist came in and grabbed the chart out of my hand and dealt with the machine that dealt with his defective body part. And it was then like the light bulb went off for me that my patient wasn't diseased and fragmented, but the system was. I chose, after practicing for a while, to take a path to support innovators from a different platform. So through my work with Earl Bakken, we launched a foundation that he and Medtronic helped fund. So through really philanthropy, we helped drive innovation. About 15 years ago, when a focus on innovation on the human experience or patient experience wasn't popular at all. There was no, customer satisfaction survey, reimbursement was not tied to it. It was not popular. It was an uphill battle, but we funded 10 centers with $1 million each to try to innovate on heart care. When you're inside an academic institution or a large healthcare system, you have to have people in the foxhole with you and have people that will support you and not take you out. So instead of walking in 20 years ago to try to change everything, I now start in smaller areas and then try to have a viral effect. And I start in areas that either have the biggest naysayer, their curmudgeon who's throwing arrows in my backside to help me, or I start with hierarchically and financially the areas that are most important in the system. So I often start with surgical specialties with heart surgeons, neuro, orthopedic, neurology, and really appeal to the competitive entrepreneurial sense of those doctors to say, hey, let's innovate on things that can make a difference and be the first in the nation to disrupt what is so broken and old in healthcare, the things we've been doing just because we've always done them. I think the most important thing I did and that others should do as an innovator is I threw on my scrubs and I walked in the shoes of every stakeholder for at least 30 days. I was down in the cafeteria with the housekeepers, with the parking valet, with patients, with families, doctors, nurses. And I came back to the boardroom and I said, I cannot focus on the patient experience until you first focus on the employee and the staff experience. And from the patient perspective, what I witnessed was the first thing we do to them when they walk through our doors, it may be symbolically, but we strip them of their dignity and respect and disempower them to be equal partners in their care. And we do that through this gown we put on them that is horrible material, exposes them, makes them vulnerable. So I looked at this and I thought, this is crazy. So I initially reached out to a couple of designers who didn't return my phone calls. And then our CEO met Diane von Furstenberg. So I flew to New York with a nurse from the Cleveland Clinic. She looked at me and said, Dr. Duffy, why are you here? Every hospital in New York has asked me to redesign the patient gown. I have no interest in this. I'm thinking to myself, why did I fly to New York to hear this? And I said, why do you have no interest in this? And she said to me, I hate hospitals. I said, why? She said, they smell, they stink, they're miserable, they're painful. And I looked at her and I said, that's why I need you. I looked at her in the eye and I said, I want you to help me restore dignity back to healthcare and respect to patients. So she agreed to take it on. And so she used her famous wraparound tie gown as the model for and the inspiration for recreating that, and we implemented that at the Cleveland Clinic.